Lake, Washera, Marquette, and Washington County. So, this is what we're going to cover in the presentation, the basics of it. I get to do the success. Dr. Troicki gets to do a lot of the challenges. And we're going to talk about what you can do, and we're going to have a panel discussion later where you can ask Dr. Troicki and myself questions. You do have index cards in front of you if you want to write down a question while we're doing this presentation. Or otherwise, when we start the Q&A, you can just raise your hand, whatever you feel comfortable with. And with that, even though we're going to talk about Juul tonight and other electronic devices, we just want to make it really clear, although we're focusing on that because we see those numbers increasing with youth use of that product, but we're really concerned about any tobacco uses concerning period. Matter of fact, when you all walked in tonight to register, you all walked past the Juul device that I had charging in the laptop. So that'll give you an idea that it really doesn't stand out unless you've seen one before. You really don't know what they are. The other thing I would say tonight, Terry's holding that up. The other thing I would say tonight is if you want to share anything about, what you've seen in schools or what you see for tobacco use, you can share personal stories, but I would encourage you not to share information about other individuals. We really want to focus on the product, the health concerns about the product, what they are, what they look like, and some of the concerns we have with youth getting access to these products. So I get to start with the good news. So I've been working in tobacco prevention and control for about 20 years. So when we look at how we've decreased our cigarette smoking rates, and this is from our Wisconsin survey that you've taken, I think there's 50 schools that participate randomly, and this is where we started. Our cigarette smoking rates were extremely high. So when you look at that number in 2000, and then you see that number in 2016, we've made some tremendous gains in decreasing youth cigarette smoking rates. So how did that happen? Well, it wasn't just education, but a lot of it was education. We were very specific, not just cigarettes are bad, they have harmful chemicals, but we also said things like cigarettes have formaldehyde, the same thing that you preserve dead frogs with, right? So we got very specific about that. But also, in about 2008 or 9, there was a cigarette tax increase. So that cigarette tax made those cigarettes more expensive for kids to afford. The other thing that we did, as you all know, the state of Wisconsin went smoke-free in 2010. So that changed the whole social norm. It's one thing to say to kids that cigarettes are bad for you, cigarette smoking is bad for you, but then you see adults smoking and you're exposed to that. Matter of fact, when I used to work with youth and go into the classroom, I used to ask them, what do you think the current percent of adult cigarette smoking rates are in Wisconsin? They'd say anywhere from 50 to 60%. At the time, it was about 24%. So perception. The other thing, when you look at the survey, you'll see that we changed harm perception, that they really started to understand that there was harm with cigarette smoking. The other thing we used to get all the time is, it's peer pressure. When you look at that survey, I think it's like a high percent of 70% of kids would not encourage their friends to smoke cigarettes. So this is what we have for the Fond du Lac School District. So this is the most recent, 2009 is as far as back as I went for the cigarette smoking rates. And then 2018, this is just the survey that we just got back. So that's 5% cigarette smoking rate. So again, we have a very active youth group. We have school nurses. We've done a lot of messaging inside the schools and out in the community and focused a lot on cigarettes. So that's how we got that number down. And again, a very comprehensive program with media, hard-hitting information, very specific, and a peer-to-peer message was used. But this is where we're at now. So, according to that same survey from the Fond du Lac School District, we have 16% of kids who are using vape products. And according to the Wisconsin Youth Tobacco Use Survey, we have 12%. So, we're seeing, you know, this is the point where we say, are we going to undo everything we did, everything we accomplished? Because it took us a long time to get those rates down for cigarette smoking rates. And we saw this coming, we knew it was an issue, and we started educating very early on. In our 5 county areas, we started doing presentations, we started getting a lot of information out there, we started putting press releases out, and again, this is where we are. And this is the other part of that school district survey where I found very interesting. When they were asked, how did they get these products? Well, 47%, as you can see, borrowed them. Gave money to someone, or someone 18 or older gave them to me. So at this point in time, I'm going to just say this is what we also see in that survey from the state, is that 87% say this. They probably would not, or definitely would not, try an e-cigarette if it did not have any flavors such as mint, candy, fruit, or chocolate. And tobacco, regular, conventional little cigars, have candy flavors as well. And this, when I saw this, and this is not from our coalition, this is not from another public health organization, this is a headline from the Business Insider. So when I saw this, I thought, well, if the Business Insider sees this and is worried about this, you know, that just confirms what we're concerned about in terms of public health. And with that, I'm going to turn it over to Dr. Troicki.
All right. Everybody hear me? I project pretty well, but hopefully everybody can hear me in the back. All right, so I'm Filip Troicki. I'm one of the radiation oncologists over at the Agnesian Cancer Center. I'm actually kind of partnered up with Sandy over the past couple of years in regards to tobacco. So I am the recipient of a lot of the patients that come through with endless smoking, etc. So cancer is what I do. So I treat a lot of cancer. And this product, Juul, really kind of scared me. So I said, yep, we certainly have to address this. If anybody has any questions, as Sandy pointed out, please write them down on those little cards so we can address them later on. But if you're hearing drooling, you're probably not in the right class. This is juuling. It's hard enough that it's a term, Juul, that sounds kind of fancy. This is what it looks like. The fancy bits, you can get different covers for it. It looks like an electronic device, which kids are using quite a bit. You can cover it, you can customize it, you can do anything. Plug it in to your computer and it looks super fancy. So even the charging case or the carrying case looks like an electronic device, something that a lot of teens can have, and it looks like maybe a carrying case to your phone. And in fact, the charging case, some of them you can get with a phone attachment. So basically it looks like a phone and it charges on the back. There's different ways of doing it. The device itself is this long thing here, and then you have these pods that you can buy, and they can come in different colors, different flavors, etc. But it really does look very, very modern, very cool. Not something that you would necessarily be marketing to your grandfather, to your grandmother. I mean, they certainly wouldn't necessarily know what to do with that, but the teens, they certainly do. Okay, so what's in a pod? So the little pods that you can get, a lot of different things are in them. And for every single one of the e-cigarette brands, there may be something else that's in there. But for the Juul, you have the nicotine in there. And the nicotine in there has to be bound to something. And it's bound to benzoic acid. And the benzoic acid is something that actually you can get absorbed as you inhale and carries the nicotine in. Okay? It takes about 7 seconds for the nicotine to reach the brain once you inhale. So it's really very quick with the benzoic acid. Okay? There's glycerol in there, there's propylene glycol in there, and by the way, propylene glycol is not FDA approved to be an inhalant, okay? So, but it is added in there as well. There's natural oils and extracts and flavors, and a lot of other things that we don't know because it's not regulated. So they don't have to tell us what's in a pod. And as Sandy pointed out before, formaldehyde is one of the products that's also in a lot of other vapors. We don't think that it's necessarily in a pod, but you don't really know what's in there. Okay. So there's a multi-pack, 4 packs, four little multi-pack pods in a multi-pack. And then it says here, mango, 5% strength. Now the question is, 5% strength of what? You know, it's 5% strength as to 95% weakness? I don't know. It really doesn't specify, right? And these are some of the questions that they try to get away with how much nicotine is in there, but basically saying something like 5% strength, that means absolutely nothing, right? So how much is 5%? You ask an average kid, well, they'll be able to tell you, 5 cents out of $1 or something like that. But 5% of what is in this pod. So, just as an aside, there are similar devices. Okay, so you have to pay attention when you're talking to teens that although the conversation may start with juuling, okay, or Juul, you have to be able to recognize, there's the Bird, there's the Mark 10 Elite, the Miley is also there. So there's a lot of different products that you have to be aware of. Because if you're not aware of them, they say, well, I don't Juul. And you say, well, what about any other devices? Have you seen it around? So it's important to realize that it's not just juuling. Although I think I read the latest statistics. I think 70% of the e-cigarette market is now Juul. Okay, so it's huge. So, health concerns, right? The problem with teenagers using this, okay, our brains develop up to the age of 25. I would like to think that they develop way beyond that, but they don't. My brain is already on the decline, and I can tell that every single day. But the teenage brain is not. Okay? It is still developing. And in fact, it is looking for nicotine. It is looking for nicotine everywhere it can find it. And it's because nicotine binds to serotonin, okay, receptors, acetylcholine receptors. It binds to things that make us feel really, really good. Okay? So exposure to nicotine, ultrafine particles, heavy metals, and cancer-causing chemicals is all a possibility, not just with tobacco products. Okay? Those are certainly the worst, but that can also happen with some of these e-cigarettes as well. And nicotine is poison. If you get enough nicotine, it will kill you. Okay? That's where that 5% is in. It's a concentration mark, right? So it's not, they can't give you 100% of nicotine because you would die after a single inhalation. So they have to basically get it down to a level that is not going to kill you. And nicotine is one of the most addicting drugs that exists. I did not plant this, but I will tell you, I saw a patient in my office today who said to me, a former heroin addict, who said to me, it was easier for me to quit heroin than it is to quit tobacco. And it's because of nicotine. We're not addicted to tobacco. We're addicted to nicotine because it makes us feel good. So, and I used to work at a drug and alcohol rehab center, and I've heard that time and time again. And I asked them how many of them are giving up heroin. Most of them will raise their hands. If you ask them how many of them are giving up nicotine products, typically all of them will say we tried and we failed. So other things that can happen with side effects of nicotine. There's the whole list here, but let me focus on a couple things for teenagers specifically. Okay, nicotine is a terrific product, okay, for a very short period of time. It increases concentration. Okay, it makes you do things that you may not want to do necessarily. Okay, so as you're studying for an exam, if you're stressed, okay, you may actually be able to sit down and do that. Concentration, memory, things like that, for a period of time until you start to get jittery. And then you say, I need another hit. Okay? And then the problem becomes that you rely on this, right, because it made you feel really, really good. You rely on this, another hit, and another hit. And if the withdrawal symptoms of nicotine are worse than anything else, because all of a sudden you have poor memory, poor concentration, and they've actually done studies where it's been shown to cause attention deficits, okay, attention deficit disorders, where people all of a sudden they can't concentrate, mood disorders, okay, where people get really antsy and they can't, pay attention. So those are real things, and a slew of others. Okay. So what worked before works again. Okay. You may say, why would a doctor want to be talking about marketing? What does he know? Well, I used to have my own marketing firm in New York City. I did this. Okay, I would sell marketing, okay, to other people, and I'll tell you, none of the companies that asked me to market for them said, is this going to be good for our population? No, they just want to make money. So you can see, these on the left-hand side are tobacco, okay, which are no longer legal to advertise in these fashions, not everywhere. And then Juul, that basically has the same type of advertising. It's being repeated. And the problem is, you don't have, your grandma on the poster there. No, you have a cool 20-year-old something or other, right? So basically the history repeats itself. Okay? So, and the marketing goes on. It's not illegal to market it, right? So now there are ways that it's illegal to market tobacco products. You can't advertise them everywhere. There are limitations. There are no limitations to Juul. So in addition, you can put it on social media, okay? So things that kids are into, okay? Instagram, Snapchat, all of these things, it's being advertised, and there's actually channels, okay? YouTube channels, how to inhale so that your teachers don't notice, that your colleagues don't notice. There's they'll tell you how to do it, okay? How to do it in the bathroom so that nobody will how to conceal it, where to conceal it, okay? And people really, and it's really interesting, and then snap a photo of you doing something, and nobody else recognizes it, right? In the middle of maps, or whatever it may be, and there's pictures like that, okay? And kids really, and they try to up each other on this, okay? So I guarantee your grandma and grandpa are not on this looking at how do I conceal, juuling. It just doesn't happen, okay? And the product placement, right? Where are the cigarettes? They're behind the counter, right? Where are these e-cigarette products? They're right next to the candy. So you cannot tell me that you're not marketing to kids, okay? I mean, yeah, I love a Kit Kat, right? But so does my 5-year-old, and my 7-year-old, my 10-year-old, and my 12-year-old, right? And then they say, oh, well, what about this juice? So that's the problem with marketing. Am I still going on?
You're still going.
All right.
Just talking about this.
I don't know where I'm supposed to stop. Sorry.
Yeah.
We're ringing the alarm. Okay. So youth who are daily e-cigarette users are 4 times more likely to become cigarette smokers, and this is where the problem is. Okay. So nicotine per se may be bad, but what's even worse is cigarette smoking. And I would say, somebody said to me, what's the big deal? Nicotine. Who cares? Doesn't matter. Well, it's like T-ball, right? When you're young, T-ball is all right. But when you're 30, 40, 50, and you're like, yeah, my T-ball league, yeah, you know, no. You transition to something that's age appropriate, which is cigarettes, right? So if any teenager said, oh, well, my grandma juuls, and I love juuling with my grandpa. No, that doesn't happen. It's age appropriate. They think it's age appropriate. And then you move on. Then you say, you know what? At this age, I'm not going to be juuling. That's for kids. T-ball, that's for kids. They're going to turn into something else because they're already addicted to the nicotine. And the nicotine, as I pointed out before, the most addicting product. Okay? Pick up a needle, start some heroin. Nobody would ever say that, right?
So I'm up. Okay. So when he talked about product placement and other things, but you know, these products are treated very differently. They're not regulated the same at all. But you saw some headlines, I'm sure, recently that the FDA declared youth vaping as an epidemic, announced investigation and new enforcement. And then there's also this from the Truth Initiative, which was one of the leaders in tobacco prevention years ago and has always been addressing this issue, trying to create the first generation of tobacco nicotine-free kids. So I'm going to explain why these are treated a little differently. So in 2009, the Family Smoking and Prevention Act passed, and this is basically the minimum of what it did. So restrict sales to minors of any tobacco or nicotine. In Wisconsin, that's 18 years of age. In other states, they just passed tobacco 21. So some states you have to be tobacco 21. But basically, that's the minimum requirement. No state can go lower than 18, but they can go higher. So vending machines are not allowed in adult-only facilities, only adult-only facilities where minors can never enter. So they're not in bars anymore. No sale of single cigarettes, and that has been an issue in some counties where they break the pack open and they sell loosies, they call them. All cigarettes and smokeless tobacco must be behind the counter under this when it passed in 2009. Cigarettes can no longer be made in candy flavors other than menthol because there was a loophole in this law that passed. But the law also gave authority to the FDA for the first time. So this is the minimum of what we have right now under that Family Smoking and Prevention Act for electronic devices. So although the age is 18 and 21 to purchase tobacco under federal law, tobacco retail employees should be checking an ID of everyone under the age of 27 who attempts to purchase. And again, the minimum age is 18, you can't go lower. Don't give away free samples of ends, including their components or parts. So some vape shops may have something up like, we can't give you a free sample, so we have to charge you like $1. We're seeing some of that. Don't sell e-cigarettes in vending machines only. So this FDA, in August 2016, they implemented the new rule called deeming, extending its jurisdiction to e-cigarettes, cigars, and previously unregulated tobacco. So even though we talked about cigarettes and smokeless, they really weren't regulating little cigars and some other things. However, in August of 2017, the FDA delayed a key provision of the rule that required manufacturers of products then on the market to provide critical information to the FDA about each product and undergo a review, okay? The FDA delayed the deadline for filing applications until August 2021 for cigars, which is not, it's not e-cigarettes, but still you should just know that. And also until August 2022 for e-cigarettes. So currently, this is the minimum requirement for those products. So this was another issue that the FDA, when I saw this, I'm like, this is not really happening, is it? So this was products that the FDA came across and became aware of. And even though they weren't going to start regulating, the devices and some of the liquid nicotine, they called these companies out and they sent them letters, warning letters to companies that misleadingly labeled or advertised nicotine-containing e-liquids as kid-friendly food products. So, you can see the e-liquid on the left-hand side with the juice box, and then there's an actual juice box next to that. So they give you examples of the e-liquid and then the actual food product. I didn't include a slide in here, but we've had an increase in calls to the poison center, because if the liquid nicotine smells like juice box or smells like some of these other candy flavored products, it must be that, and kids have drank it. So for a while there wasn't even a tamper-proof requirement at the federal level, but they did eventually pass that. So these are warning labels. That doesn't mean that the FDA has done anything beyond the warning letters that they've put out. So that's terribly concerning. And like Dr. Troicki said, unlike cigarettes, these products can be advertised on radio, television, billboard, social media, anywhere. So as you can imagine, our kids are being exposed to all of this, and that kind of creates that social norm. And I think the other thing you kept hearing is safer than a cigarette. Well, that's setting the bar pretty low for our kids. The other thing you might have heard is they're a cessation device. What I would share with you is not one of those companies has submitted that device to the FDA to be approved as a cessation device. And there is a method to do that. So, this is the summary that we have. Youth vaping rates are on the rise. We should be concerned because we've learned a lot about tobacco prevention, and everything we're seeing now is the same thing we saw with the advertising with tobacco. Harm reduction. I think you're making a big deal out of this. I think as a community we need to be aware, we need to be educated, and we need to be paying attention to what our kids are getting, including over the internet. Because I ordered 2 Red Bull e-cigarettes on the internet, and it just basically asked me if I was 18. They were $9 a piece, and they came right to me in the mail, in my mailbox. And they kind of look like they're a marker until you open it up and you see the actual e-cigarette, and then the e-cigarette also looks like a little marker as well. So that's part of the problem. People say parents need to get involved, they need to do something. Well, they need to know what these things are and what they look like, and they need to know that they're not really regulated. And I will turn it over to Dr. Troicki. Actually, the next slide. There we go.
So the question about what do we do, right? And I think it starts off with education. It's education of all of you. It's education of our kids, our youth, talking to people, okay? Now, I'll tell you, and I'm very much aware of this because the first day of medical school, my attending told me information does not change behaviors. No matter what you do, you can educate people, you can talk until you're blue in the face, but that education should start with our kids, who are indeed very much willing to listen if we actually talk to them. If we talk to them on their level and not being necessarily judgmental, but rather, have you seen this around school? What do you think about it? And getting into the conversation. Do you know what the dangers are, etc. Because I think the kids are willing to listen. Right now, they're getting so much peer pressure because everybody else is doing it, right? They're a little bit myopic because they haven't lived long enough to see what that all can cause. There are resources. There are websites. CDC website, our own website in Fun Life.
Yeah, and I'm going to talk a little bit about that in the next slide that we have going on.
But there's websites. If you don't know how to start a conversation, there are resources out there that will start that conversation for you, okay? If you're passing on a billboard, for example, that shows that, somebody that is vaping sees it, you can ask them, why do you do it? Is that marketing effective? And ask that question. Nobody wants to be, called out, because if the kids think that you're being too judgmental, they're going to hide it even more. But I think having a genuine conversation is really worthwhile. Okay, I think it's really very much worthwhile.
And I had to share this because this is part of our FACT group, and I think we have a couple of FACT members in the audience. Just raise your hand. Yeah, you're a superstar. Okay, so with our youth group, they not only like do a peer-to-peer message in the school, but they go out in the community, and we call this like a human billboard. And yes, they did stand on the corner of Johnson and Main and said, you know, e-cigarette use has tripled, you know, among kids. And sometimes, you know, we don't always get the best shot of them. But they also have been out at Walleye Weekend doing sidewalk chalking. Because like Dr. Troicki said, even adults don't like to be lectured about the addiction piece of it. But if you do it in a creative way that informs them and lets them know about things like formaldehyde. I think one year we did something with Domino's Pizza where we had a flyer that went out with Domino's Pizza that said, formaldehyde is added to tobacco, or in tobacco, would you like some of that on your slice of pizza? You know, it's just a really creative way of getting information out. So one of the things we have here tonight too is we have sample policies over at the table for any school who doesn't currently have an updated policy that includes prohibiting the use of these devices. And it's a best practice policy. The Fond du Lac School District has a policy. In my 5 counties, I usually reach out and check in with them and say, what does your policy currently say, and how do you handle this situation? Because I guarantee you what I'm hearing from schools across my 5 counties is that this is a problem. And I have a bag full of devices that have already been confiscated from 2017 to this year that the police liaison officer from the Fond du Lac High School gave me tonight. And I was even a bit shocked when I saw some of those. And she already confiscated 7 devices since the beginning of the school year, which started September 5th. These are the resources that we have. We have hard copies up there at the table. And we also will post all of these on our tobaccofreelivingfdl.com website so you can access those. We have a lot of additional information as well when it comes to, we have some e-cigarette brochures up there. And anything that you find on our website you can use for educational purposes. So we also have how to talk to your kids up there, tips from the CDC, and frequently asked questions about these devices. And as Dr. Troicki said, in terms of the Juul, they have the largest market share of electronic devices. It is a $16 billion industry. And not only has the FDA sent them warning labels, they want to know about their marketing practices, but this company has also reached out to schools, offering them money to come in and do a youth prevention program. But yet, they seem to be a little bit concerned about the regulation of some of these devices. So we've really reached out to the school and said, you know, really, in terms of best practices, you probably want to look at the CDC or some other area for your youth prevention programs, and they were offering quite a bit of money. The other thing they're doing is they're offering to pay students, and they're saying 18 and up, probably college students, to write some kind of paper on why they like to Juul, and they will pay them for that. So back in the day, and I think the industry still has a program called Right Decisions Right Now, and it's all about putting the responsibility on the youth, which there is a responsibility. But also, when you look at how these products are marketed, how they're sold, how they're packaged, candy flavors, I mean cotton candy and gummy bear liquid nicotine, you have to ask yourself seriously, who is that really targeting, right? And again, as far as the cessation piece goes, we won't know. The Wisconsin Quit Line is doing some research to see if, you know, adults are actually quitting. What we're seeing so far is they're switching. That's a different area of concern. What we're mostly concerned about is we have a new generation of kids who would never have considered smoking a conventional cigarette, who are all over these and all over our high schools. So what I say to you tonight is if you would share this with your colleagues, friends, family, and community, And if you're interested in joining our coalition, that would be wonderful, because then we can get out to your contacts, your organizations, your network, and do some additional presentations, or I can even train you in some of these presentations. And at this point, I guess we'll start our panel discussion. Dr. Troicki, do you have anything you want to add to our presentation at this point?
Yeah, there's one thing that I kind of forgot to mention, and you just reminded me. So the flavoring, which I think is a huge component. So Juul, if you go on their website, it'll actually say they're founded to help people quit smoking, which is a great idea. I think it's terrific. Okay. However, who in their right mind, who is smoking a pack or two a day for the last 40 years, has reached the age of 65, and their oncologist says you should quit smoking because you developed lung cancer, or right before you developed lung cancer, who in their minds is going to go out there and say, you know what, you're right, let me go and buy the bubblegum flavored Juul, because that's going to help me quit smoking? Nobody in their right mind is going to do that. Nobody's going to believe it, right? Meanwhile, you have all these flavors that are targeted for our kids. I mean, in reality, all of these things, you have to think like a marketer, okay? And you have to put your marketing cap on and say, who is the target audience in this, okay? And I guarantee you that the biggest uptick in e-cigarettes and in juuling is not adults that are trying to quit. It's our teens, okay? It's the young adults that say, well, it must be accepted because we don't hear anything bad about it. My parents don't never say, oh, you know, do you Juul? Do you do all these things? No. We may talk to them about tobacco. You can smell tobacco, right? And you're going to say, if your teenager walks in smelling of tobacco, where were you last night, right? With juuling, it's never going to come up. You can't smell it. You can hide it. They're not going to ask, what is that case, you know? You assume, well, it's your cell phone, or it's some other electronic device that us as parents have no idea about. But start the conversation.
Another thing I probably forgot to mention is, under that same Family and Smoking Prevention Act, states have the ability to do things with tobacco products. They have the ability to put all these tobacco products behind the counter, just like they did with cigarettes and smokeless tobacco. They have the ability to prohibit flavors. There's a lot of things that they can do, and there's a lot of research and best practices that supports that. We've been doing this for a long time, and we've seen states probably go a little bit stronger, and we've seen those use rates decrease and go down dramatically. So that's the other piece of this, is that, you know, there's certain things that we can do in terms of, like Dr. Troicki said, be aware, know what they look like, talk to your kids. But there's certain things that leaders can do as well to help us. I'm still optimistic that we could create the first generation of tobacco-free kids, because I remember people saying, did you ever think you'd see a smoke-free Wisconsin? I said, absolutely. So with that, I guess we'll go to our question and answer, and if anybody has any questions, you can either raise your hand or you can, you know, give us those cards if you wrote a question down.
Yep.
What is the nicotine content between a cigarette and one of those Juuls? Is it equivalent? Or?
So one pod, okay, which typically that's what kids can go through a whole pod, is the equivalent of one pack of cigarettes. It's, yep, so it's 1-to-1 ratio. And the thing is, another thing that I wanted to bring up, you can get a lot more nicotine in the way that you can vape through a Juul than you would for a cigarette, right? Because a cigarette will actually burn out. You only get a hit when you're inhaling on a Juul. So a cigarette, you can sit there in the ashtray and you get distracted and start texting, right? Half of it burns away. So you you know, it's the equivalent of, but not the same consumption. Does that make sense?
Also, in some of the liquid nicotine that are sold in bottles, and I have several examples of some of the vape devices that are tank systems, sometimes they're not labeled, so you're not sure how much nicotine will be in that bottle, because there's no requirement at this point for them to label them. And the other thing is, you know, people who think they maybe are making a safer choice, even adults, we're not sure how they're dosing themselves with this nicotine. So are they going through a whole bottle, you know, in a couple of hours? Because like Dr. Troicki said, with the Juul, in one of those pods, it has the same amount of nicotine as you have in an entire pack of cigarettes. So that's the other question. If you have it hanging around your neck and you're sucking on that all day long. And with the tank systems, you can refill those, right? You have the liquid nicotine. Some people have spilled the liquid nicotine on their hands and ended up in the emergency room. It's, you know, it's a poison, right? So there's some other issues with some of the devices, not so much that I've heard with Juul, but sometimes the batteries malfunction and they can blow up. Or sometimes when they're charging them, they can start on fire. So the other thing is, you know, these aren't pharmacists all the time mixing these liquid nicotines, right? They didn't go to pharmacy school. And with vape shops, there is no requirement for them to have any type of tobacco retail license at all. So if I go to a gas station where they sell cigars and other things, they have to have a tobacco retail license. Vape shops do not. So there's no requirement for, you know, the mixing, the storage, and for a time, I think some of them were buying their liquid nicotine already pre-packaged. Questions?
Isn't the government kind of dragging their feet on this if they're not gonna do anything until 2022?
Well, I can tell you that there's a huge outcry right now, and I think it happened because of the Juul. And there's several organizations, American Lung, American Cancer, Cancer Action Network, American Heart Association, American Lung, that have said to the FDA, you need to deal with this now, this is a problem. Yeah, so the FDA has had the authority, but there's a long process that they have to go through. The first thing the FDA tried to do was regulate these devices as drug delivery devices, and the industry challenged them. So even though the FDA, you saw, you know, they know this is a problem, they know they have to do something about it, they can start that process and, you know, like the industry can come in and challenge that. So sometimes it's a little more complicated than what it seems.
What is the cost compared to cigarettes?
Well, you know, one of these Juul devices that you get in a package can be anywhere from, I think, $30 to $42 to $50 some. But it comes with 4 pods of nicotine in it. So that's like 4 packs of cigarettes. Pack of cigarettes usually goes anywhere from 8 to maybe sometimes bar selling for $10. So it depends on how you're using it, how much juice you're using it, if you want to compare that. Some of the disposable devices, you know, they can go anywhere from $9 online to maybe $12 or $13 sometimes. And we include electronic devices in our tobacco compliance checks. Every state has to have a program that ensures that we keep tobacco out of the hands of kids. So part of what we have to do is we have to check retailers to make sure that they're not selling any liquid nicotine or tobacco to minors. And for the state of Wisconsin, if we don't keep that number below 20%, the state can lose like $10 million in federal funding that has nothing to do with tobacco. So we try to send out information to retailers to say, this is what a minor's ID looks like, this is what some of these products look like, because honestly, sometimes they don't even know, I don't think they're sure they know what they're selling. Well, what is this thing? You know, when I say, well, that's liquid nicotine and this is the device. So because there's so many new products, you know, it can be confusing. So it depends on, you know, what brand you're getting. If you're going into a vape shop and you get a big tank system, it might be, you know, it could be up to $100. The police liaison officer informed me that she's confiscated some of the bigger tanks, and some of those run for anywhere from $50 to $100 from minors in the school.
You know, and I've heard of cases, not in this state, but I've heard of cases where somebody who's not a minor will buy in bulk and will become a distributor for the school. And the kids know who that distributor is. So it becomes one of that, you know, you can actually earn some money on this because it's easy to sell in school, very easy to sell in school, because nobody really knows what you're paying for. It looks like a pack of gum. And people can buy in huge quantities. And the FDA at one point in time said, well, maybe we should be looking at bulk orders, you know, but how do you know that that's not going to a vape shop, that's going to somebody's residence? And so they're trying to come up with ingenious ideas of not selling in bulk to individuals, you know, your older sibling or whoever it may be that's trying to earn some money. But that market is now also open in schools.
So there's many points of access for these devices and products. And parents, I believe, you know, want to do the right thing and they want to prevent kids from getting these. I don't believe that retailers are intentionally selling to kids, but during our checks we've had, retailers sell to minors. It's never a good time in my job when I have to go in and address that, but the majority of the time, if a sale takes place, I walk back in, I tell them the health department, the good news is you asked to see an ID, the bad news is you didn't read it very well, so we go over it again. And a minor's ID under the picture will tell you the day, month, and year they're going to be 18, the day, month, and year they're going to be 21. So that's just another way we try to work with retailers to ensure that their employees know to always ask for an ID, know how to read it. And you know, the cash registers are different. Sometimes they have to put the date of birth in there. Sometimes they just swipe it. So we try to help them be successful.
You had a question in the back there.
So what's the youngest age you've seen kids using these?
Well, when you look at the school survey, it says the average age of onset is 14 years of age. I think another part of that that's very confusing is when you hear, you know, it's just water vapor. And kids who have been asked about this, when they're confiscated, they're like, well, what's the big deal? You know, it's not like a cigarette, it's just water vapor. So, and you'll hear a lot of adults say the same thing. And I always come back to, well, it may not have 65 cancer-causing agents like a cigarette, but there's still health concerns like Dr. Troicki said, and especially for young people, their brains are still developing and nicotine is extremely addictive.
And you know, another thing to point out, a lot of the times the kids will know, they've heard it before, so it's not going to be news to them. You're not going to be opening up a Pandora's box if you say, you know, have you heard of Juul? I had a conversation recently with a couple adults just trying to ask, you know, what do you know? And they say, I've never even heard of it. I've seen it advertised, I don't know what it is. Then I asked just a poll of my kids' friends, I said, ever heard of it? Oh yeah, oh yeah, oh yeah. So they know. It's not news. It's not like, you know, we have to hide these things. You have to start the conversation, because if you don't, then the peers will. And you know, you don't want to be getting the false information from your own peers. You want to be the one that basically says, well, let's do some, you know, fact checking on this, and let's have a conversation. What makes you attracted to it, you know, and have that conversation. And I think it's important. I think we owe it to our youth. You know, you don't want to have a whole generation. I was talking to a veteran today who continues to smoke, and he says, you know, the government made me start. Well, yeah, because the government, he was out of the service, and he got as many cartons of cigarettes as he could carry. And he says, yep, and it was either you're smoking or you're doing push-ups. Your choice. And he says, yeah, it's a terrible habit. The government made me do it. And now, if we accept it and say, you know what, eat cigarettes, whatever, who cares, right? But as I mentioned before, nobody, or at least I can't predict, that in their 50s, 60s, 70s, people are going to be going after Juul and saying, you know what, this is where I get my fix. No, they're going to switch to another product, because that's what happens. Yeah.
I know that I have a couple friends that smoke vapes, and then they have the refill bottles that they say do not have nicotine in them. Is that true, or is that all other things?
Do you know
Well,
something?
because, you know, there's,
Can you repeat the question for me?
oh, you asked that some of the liquid nicotine says the liquid has 0 nicotine in it, and that may be the case, but there's no requirement to actually put that on the label at this point. So even when we've had our tobacco compliance checks and there's been a sale of liquid nicotine, I have to look really close at the bottle to see what the labeling is. And like Dr. Troicki said, with the Juul, with the pods, it said 5%. Well, 5% of what, right? But what I wanted to kind of bring to your attention is when I went to the high school today to ask about what they're seeing, you know, this is just a bag of the liquid nicotine rices that look a little bit smaller. You know, I was really, and of course she has some Juul too, but these are what she's confiscating in the Fond du Lac High School.
The other concern with the bigger tank ones is they can use those to smoke wax, marijuana wax, the THC concentrated stuff. And there's very little odor that is given off.
So that was another thing that was shared with me while I was talking to the police liaison officer. I think the other thing is, you know, when you have the liquid juice, whatever it is, you have the ability to melt pretty much anything down in a spoon. You can also put in this device and smoke it. And so, you know, that's what she reported to me as well. So, and she did, you know, I mean, and what's the consequence, okay? Every school district has a policy, hopefully. If you're with a school district, you're gonna go back, you're gonna look at your policy and update it. So first of all, in the state of Wisconsin, it's illegal for anyone under the age of 18 to have tobacco or nicotine. So law enforcement has the ability to seize it right away, right? And then they might get a day off school, right? Or if they're distributing and selling, they could get 3 days off, or maybe they'll get expelled. But when I asked also, are some of the other students perhaps, or somebody who's, you know, an older adult who can buy these products, are they being sold to the minors? And yes, they were. So that's another issue that we're seeing. And as you can see, this is probably from 2017, and she didn't even give me, I have a whole bag full, she didn't give me everything. But what we need to do is pay attention to this, because as coalitions, you know, we have 14 coalitions that cover the entire state. We used to have 41. This is what we do. We bring people together, we do presentations. We're not lecturing, we're giving information. We're telling you what the resources are. We're telling you currently how they're being regulated. So it goes beyond that nicotine is not healthy for you. I mean, this is a whole new generation of kids, like I said again, who would never even consider smoking a cigarette. So they don't see this as harmful. They're able to get them. And for adults who are using them, the only thing I can say to that is take it outside. Keep it away from the kids. Don't use them and expose them. We don't know secondhand everything that's, you know, in this vapor, and we refer to it as particulate matter, right? And also, if you got e-juice, put it up, lock it up, keep it up. Because if it smells like Smurf or cotton candy, then it must taste like that. And again, I said we've had some issues with children drinking that and being poisoned by it. Any other questions? suggestions.
Do you go to the schools and give presentations like this?
What we do is for Fond du Lac, and a lot of the schools will have, the school nurses, which we have one here with us tonight, Ms. Shippey, and we get resources to them, or they tell me what resources they have, and they have a curriculum, so they do a lot of that in their life skills class. I know for quitting tobacco through the American Lung Association, they have a Not on Tobacco program, where if kids are, you know, currently using tobacco and want to quit, they have that. That's going on in the schools. But again, for curriculum, I have some resources up at the table, and I will put those on our Tobacco Free Living FDL website. And I forget, Patty, what's the name of the curriculum you guys are currently using? Is it, it's Breathe something. I think I had it on one of the slides.
Catch your breath.
Catch your breath. So there's a middle school curriculum and a high school curriculum. And then again, CDC has a lot of information, and even CDC has some videos. And they have a couple of, I think, MDs in one of the videos that asks kids who wants to be an experiment, and then talks about e-cigarettes. So there is some information out there.
And I would say, you know, if anybody's from a school and you would like me, and I can't speak for Sandy, but anybody would like me to come out and talk to the kids, I would love to do that. You know, this is just as much your kids as my kids as everybody else. And I think it's sad to know that, you know, the industry is having the last laugh to the bank. I mean, billions and billions of dollars, and that advertising, I'm telling you, it makes somebody rich, because, well, I was there, and it's so easy. I mean, it is so easy. So we just have to be aware. And, you know, if you'd like me to come out to any schools and talk, I would be more than happy.
No, I can't anticipate this, but I think that eventually the federal government kind of poo-poo thing and let me delay that. Will the local communities just have their own ordinances?
So the question was, you know, if the federal government is kind of, mostly I think the FDA, because they have the authority, if they're going to drag their feet, can local municipalities do certain things? Well, we have to look at, you know, does the state have the authority, or does the local municipality have authority? Like, for instance, with the statewide smoke-free air law, local authority, they can actually include prohibiting these devices in all work and public places. I think so far there's been about 13 cities that have done that. So local has the ability to do that. So I think that's something where you talk to your city councils or your, you know, city attorney. But there are things at the local level that can be done. So so far I think there've been about 13. I don't have the updated list, but Madison, Oak Creek recently, Milwaukee. So what they've done is they've just brought the smoke-free ordinance back at the local level, and they updated it to prohibit also the use of these devices in, you know, if you can't smoke a cigarette, you can't use these devices either.
Okay.
Yeah. Any other questions?
So when they come into the poison, what they come in for nicotine poisoning, what do they actually do?
If they do have poisoning,
Correct.
there's several things that they can do. Typically, they will just pump them out. If it was an ingestion, they'll pump you out, and they'll give charcoal, which absorbs some of these poisons out, and they'll send for monitoring, do a lot of IV fluids. Typically, the problem becomes kidney failure. So, you know, patients that ingest any types of poison, liver and kidney failure. And I've actually seen that happen, you know, where young people ingested too much of a poison and their kidneys are shot, as in you need dialysis for the rest of your life. And that is a shame, because nowadays, even with the dialysis centers as they are, you know, you still have to adjust your lifestyle, to be going on dialysis every 2 days, so 3 times a week. So, you know, you can say goodbye to any travel plans, camping is out of the question, and et cetera. So, you know, it is a dangerous thing, and luckily most people don't get to that level, but little kids, the problem is, you know, they will ingest, and these are toddlers and whatnot, they will ingest anything that smells good. And it, you know, it's hard to tell them, you know, you gotta spit it out. No, it gets swallowed first. You know, the last thing a parent wants to do is rush their child over to the ER and see them being pumped out.
I think the other thing you can do for yourself for research, you can go to fda.gov/tobacco and look at adverse event reports. Look at some of the individuals who are using these products reported symptomatically some of the things they experienced. And again, those might not be confirmed, but these are people that can, you know, write in and fill out a form as to, you know, I use this product and I had an allergic reaction, or, you know, I thought I had pneumonia, or things like that. So it's a case by case, but again, I would encourage you to kind of go to the FDA website and do some of your own research as well, because we're going to focus on prevention and preventing kids from experimenting with these, and so that's part of our focus. And then with the coalition, we do a lot of working with businesses. I've had calls like, how should I handle this with my employees, and, you know, what about a cessation device? And I say, well, you know, it hasn't been approved for that. So you really hear some information, you know, do your research. But currently, the majority of workplaces that I've worked with has just updated their policy and prohibit the use of these things, including our city-county building in Fond du Lac, and all my other counties updated them to prohibit the use of these, because we did have some people coming in off the street with their e-cigarette and using it while they were there to do business in the building. So, you know, they just decided they wanted to prohibit that, so. Any other questions? Go ahead.
Do you find that if the teenage use has increased, do you find that it's more common in kids that just have like an anxiety issue or depression or something when they're taking e-cigarettes?
So the question, so the question was, do you see kids who may have, you know, other anxiety issues, are they using these more? I can't really speak to that, right? Because this is across the board like anything I've never seen. I mean, when we look at tobacco, conventional tobacco, we know that it's lower income, that it's lower education, that it's maybe adverse childhood experience, something like that, maybe some trauma. But with this product across the board, you know, what we're seeing is kids, again, who would never traditionally use a regular cigarette, so we don't have that kind of specific information. Matter of fact, some surveys just started asking questions about e-cigarette use. So one of my other counties just added it for the first year to their school survey, and their numbers were significantly high.
Let me kind of add to that too. So we know from tobacco use, for example, that people with mental illness, schizophrenia, bipolar disease, those people tend to smoke more because it's self-medication. It's basically they're able to calm themselves down, their brains down, and they're chain smokers. I mean, they will smoke through 3, 4, 5, however many hours they're awake, they'll have a cigarette in their mouth. That is, part of it is that nicotine that they're trying to get. I have not seen any studies that would try to convert those patients into just nicotine products. I'm not sure whether anybody has ever looked at that, where it would say, oh, you know what, since tobacco is so bad for you, let's have the switch in here. And you'll be able to tell, interestingly enough, if anybody smokes here or used to smoke, you would notice that when people wake up in the morning after being off of nicotine for such a long time, the first drag is completely different than your last. Completely different. People will suck that nicotine in so hard, okay, with that first drag of cigarette to get that nicotine in, and then they try to maintain that level. With e-cigarettes and with Juul, it's not a question of how much are you inhaling. That peak is basically instantaneous. So you're always on that peak. And you can just put another case in, and you can just put a second case in, and it feels so benign. It feels so, whatever. I have a couple of pods sitting here. I'm out of this one. Let me put it. And nobody's even counting anymore, So a pack of cigarettes is a little bit different because you're counting the butts and you're counting this and that. Here it's like, well, another pod and that's it. And then, oh, can I borrow your pod? And there was a recent article in The Atlantic, or maybe it was the New Yorker, of a lady who wanted to try out what this juuling was all about. And she said, and she was in her 20s, and she said it made her feel really good. And she said, I can totally see the appeal of this, completely. And she said, I went to the bar and I noticed other people doing it. And then somebody would come over and said, what flavor do you have? And then it was almost like, oh, now I got to know you, let's share a pod. And they did. And she's like, it's almost like a social experiment where even the most shy person can walk up and say, oh, can I share this with you? Or, can I, it used to be, can I bum a cigarette off of you? Well, now you can say, well, what flavor? Oh, well, I have this one. And it's almost like trading cards. So it's interesting, and it's interesting for kids because it is like trading. So I thought that article was really interesting because she's like, oh yeah, I can totally see the appeal in this. Totally, completely.
So for kids, it's like being a social activity.
Oh yeah, even for the shy kid, somebody who's just, you just put, and the people in the know will know that that's the pot. The people not in the know will not know. So, they could just put it out there and somebody's going to stop by, even the most shy kid, their desk and say, hey, what flavor? Or, I like your cakes, or whatever it may be. And it becomes a social network. Nobody's going to say, oh, is that a Marlboro?
Yeah, and like you said, there's other copycat devices. So even for myself, when I got the Juul, I looked at it and I'm like, how do I put this pod in? So I Googled it, and at first, one of the curriculums said you can't refill these pods. So as I'm figuring out where to put the pod in the Juul, I come up on the YouTube video. That's the kid with gloves on refilling his pod. So he's mixing his own liquid nicotine and refilling the pod. So again, if you want to learn a little more about this, just YouTube Juul, and you'll see all kinds of videos that come up on the how-tos. And again, for the industry or anybody else, we know what works, best practices, keep them out of the hands of kids, eliminating that social norm, telling the truth about addiction. It's easy to start, it's really hard to quit. And of course, we're always trying to help anyone quit conventional tobacco. So for anybody that that wants to quit, it's 1-800-QUIT-NOW. You can call the Wisconsin Quit line. They'll walk you through what worked, what didn't work before, how much do you smoke, have you tried medication before, and if they are an individual that can use the nicotine replacement therapy products, the Quit line will actually send a 2-week supply right out in the mail. It's usually not enough. They usually need at least a 6-week supply, but that's also, there's a lot of quit information on our website, Tobacco Free Living, and they have all kinds of social media, Quit for Life Facebook page. They have apps out now. I piloted some of those apps, and some of them are really motivational and funny. Like one was, your iguana's gonna love you for not smoking in the house anymore, right? So some of them have been very helpful for people. So we want to be clear too that we're still concerned about conventional tobacco use, and that we wanna help anyone interested in quitting to be able to do that. And sometimes it takes 9 times before they're successful, so.
And one thing that I wanted to add, you know, this is so new that I don't know that many people that are trying to quit juuling. You know, so it's not like we're saying, oh, you know, it's easy to quit juuling, you just put it away. I have no idea. You know, this social experiment is so new that we don't know how hard or easy it will be. We know that nicotine is the most addictive substance in the world. So we assume that it's probably not going to be that easy. But, you know, it's easy to start because it's cool, and it's easy to transition. And another thing that I wanted to point out is in a lot of settings, the reason why people sometimes switch over to tobacco products is because they left their Juul at home and somebody has a cigarette. And you need that hit. And you can ask around, and if the crowd doesn't have another Juul that you can suck on, give me a cigarette, okay? And that's typically how it starts. And it's easy. I mean, it really is that easy.
And the Wisconsin Quit Line has reported that they have been getting calls from individuals using the e-devices, and they needed help to quit those. Again, we don't have a lot of research. The Wisconsin Quit Line is doing that, but you know, there was a young man who started a movement with the e-cigarettes, particularly the Juul, because one student was brought in to the principal's office so many times for the Juul, and he just said, I'm so addicted, you know, I don't even know how to quit at this point. So, like Dr. Troicki said, we don't have all that research yet. We definitely know who's starting. We're not sure who's quitting, but who's starting our kids.
One thing I will say is that using nicotine to fight off nicotine or to wean yourself off doesn't work. You know, the only way that you can truly give off nicotine is, you know, by cold turkey. And by going cold turkey, you definitely find your demons. You know, it isn't always the nicest way to do it. And you don't quit just once. It'll be multiple times before you are truly able to break yourself of the habit.
Yes. Typically, 7 times is the average that I tell my patients. That's the average number of times that people try quitting until they succeed. 7 times. I mean, how many times would you try to start a car if it's not starting up? I mean, you know, give it once or twice, and you're like, you know what? No, it needs a new battery or whatever. People are really have to be motivated because there's a lot of ways that will pull you back in. You know, I had one patient only in my entire career who sold his house in order to quit smoking, sold his house, moved to a new neighborhood, okay, sold his car because that car smelled like smoke, reminded me of him. Changed jobs and changed friends just to quit smoking. So moved to another town, changed basically everything about him because everything reminded him of, you know, you take that corner, well, that's where you get your cigarettes. So you take that corner, or you know, everything had to be replaced. That coffee mug, he says, I can't have that coffee mug because that's when I would pick up the cigarette. I'll tell you another story of how addicting tobacco and nicotine is. I had a patient in the ICU, brain dead, completely brain dead, intubated. I put a pen in between his fingers. The first thing he did was this. Brain dead. Had no, you know, you couldn't converse with him. There was nothing going on upstairs, but it was this, and, you know, the brain remembered. Heavy time smoker, lung cancer everywhere. Yeah, and, you know, that's the power of it.
Well, and I think what we've learned too is quitting is different for everybody. But what the research shows is if you do medication and counseling, both of those things together, you're more apt to be successful. For somebody who quits cold turkey, if that works for them, that works for them. But the research has shown that medication and counseling, those two combined are better than either one alone.
I just saw, I think it was advertised on social media, where they're selling these little acupuncture things you put in your ear to quit smoking? I mean, is that just,
Again, yeah, I can't speak to that. I think Dr. Troicki would be better to speak to that. But again, I think what you believe in and what you think is gonna work and how motivated you are, tell your friends, tell your neighbors, don't smoke in your car, don't smoke in the house, don't allow other people to do that. It's all a trigger. And I would add, where those products are placed, those little cigars and other things that are cheaper, if I'm trying to quit and they're next to the M&Ms, I might think I'm just gonna get some M&Ms and oh, I'm just gonna get one cigar, one little swisher, and that's all I'm gonna have, and I'm right back to a nicotine addiction. So acupuncture, what do you think?
You know, I think there is no silver bullet, and I think it works for some people and it's great, okay? For other people, it will not work. I think what I always tell my patients is I encourage them to always quit. Every single day they should be thinking about quitting. Every single day. There should be no moment. So I say to them, if you're a chain smoker, okay, put a timer on and say, I'm not gonna have a cigarette for the next 5 minutes. Do whatever distracts you. That 5 minutes is the 5 minutes that you did not have a cigarette in your mouth. Okay, and start there. Start anywhere. Okay, because it is very, very dangerous. The worst thing that that happens is when I sit down with whole families and they say, "This was a preventable thing. I wish I had never." Nobody ever says, "Oh, I am so glad I smoked. Oh my gosh, you can't believe how glad I am." Never, ever, ever has that happened, and it will never happen. Every single one says, "I wish I never started." And if we have a whole generation of kids that are doing it, that are starting, that is terrible. That is really bad. Because all of us, right, will have to pay the price. We're going to be sitting down with these kids as parents, as grandparents, and we're going to have to say, you know what? Do you wish that you never started? And they would say, yeah, I wish I never started. And, and obviously, everybody's different, and some kids can walk by and say, you know what, I'm not interested. But there's that peer pressure, and there's the acceptance, and oh, it's just water vapor, and there's this and there's that. You have to accept responsibility for a whole generation. I mean, I don't want to be working until I'm 90, taking care of cancer patients. I probably will at that time have better things to do. But at the same time, if we're doing so well with tobacco, and then we're going to go back, and all of a sudden we have a whole generation because we stay silent and we say, you know what, whatever. And these products have only been out for 5 years. Okay, I mean, when you think about when tobacco was coming out and the government was giving these big boxes of cigarettes, nobody was like, oh, in 30 years, your oncologist will see you. Goodbye. Nobody thought about that. Right? But now I'm seeing these patients and these poor families, and the cost. This is another thing that I wanted to point out. The cost of one person starting to smoke to society is $181,000. That's one person starting to smoke, okay, over their lifetime. Loss of productivity, medical bills, this and that. $181,000. So we're outraged that education costs so much. I'm outraged that education costs so much. I'm sure some of these variant students are saying education costs so much. But nobody's saying, oh, here, start smoking, and I'll give you $181,000 for the rest of your life. That's what you're going to get because you started smoking. And that's a cost to society. That's a cost to us. That's not even including, the cost of livelihood and all those medical visits and all that anxiety and worry and everything else. Right? It's real. It's real.
And just about every workplace has a wellness committee who is always trying to get their employees to make a quit attempt. It's a lot of healthcare dollars. And again, if we invest in preventing kids from starting, because 90% of current adult smokers started when they were kids, right? Thought they could, were smarter than addiction and knew better than what their parents knew. I mean, that's basically always the story. So we really have to be prepared, we have to be informed. And I, again, encourage you to do your own research. And again, if anybody's interested in a presentation, if you have an organization, church, youth, whatever you have, you know, you can let us know and go to our website, tobaccofreelivingfdl.com, and you'll find a lot of the resources there, and I know we're going to share this whole presentation as well as it's Facebook Live.
Any other last minute questions?
Go ahead.
You talk about these kids.
Right.
So like, what is the ratio, like 1 in?
Well, it depends, like, you know, what I said is 16% of Fond du Lac High School students are currently vaping. If you go to some of the other counties, that percentage might be higher. So, you know, each school district decides if they're gonna participate in a survey, and at the state level, you know, we have that 12%, but the 2018 survey hasn't come out yet. So that hasn't been released.
And how many students about are?
Oh, I'd have to look at that. You know, it's over 1,000 students in I think in the Fond du Lac School District survey that they did. So, and that's been done for years, you know, because they're asked, well, do youth really tell the truth? Well, the researchers look at that. You know, it's peer reviewed. It's been peer reviewed for years, and they find that, you know, the kids are just as truthful as the adults are.
Because morally, ethically, everything else is just not right for, you know, the future of our generation. Because if it was really used like it was intended to be used to help people quit smoking, we wouldn't have the problem with the kids trying it. Okay.
Well, and the other thing too is, like I said, there's a process with the FDA to submit those devices to be approved as a cessation device. There's a process for that. So at this point in time, I'm not aware of any one of those businesses doing that. Any other questions, comments, suggestions? We're always looking for good suggestions. Anybody? Well, with that, I want to thank you for attending, especially because this is such a concerning issue for us. Please visit our website, tobaccofreelivingfdl.com. Reach out to us. Look on our website for our youth prevention information. We have e-cigarette information on there, quit information, and please contact either Dr. Troicki and I. Again, if you have any additional questions, and thank you for coming.